Wait, before you skip this video, 80% of Nclex test takers fail this part. Gynecological questions that look simple but are full of traps. Today, I'm giving you 50 of the most difficult gynecological Nclex questions, the kind that separate those who pass easily from those who get stuck. Every single question comes with a powerful rationale that explains why the right answer is right and why the wrong ones fail. If you stay till the end, you'll not only understand the content, you'll unlock the thinking strategy top-scoring nurses use to beat these tricky questions. So grab your notebook, stay focused, and challenge yourself. Let's begin. Your Nclex success story starts right now with Nclex Made Easy 91. Question 1. A 34-year-old woman with polycystic ovarian syndrome, PCOS, presents with irregular menses and infertility. Which of the following medications is most appropriate to induce ovulation? A. Metformin. B. Clomiphene citrate. C. Progesterone. D. Oral contraceptive pills. Answer B. Clomiphene citrate. Rationale: clomiphene is a selective estrogen receptor modulator that induces ovulation by stimulating FSH and LH release. Metformin improves insulin sensitivity but does not directly trigger ovulation. Question 2. A nurse is caring for a patient with endometriosis. Which finding most likely supports this diagnosis? A. Pain that occurs only after intercourse. B. Cyclic pelvic pain relieved by NSAIDs. C. Dysmenorrhea that worsens progressively and in fertility. D. Menstrual irregularity without pain. Answer C. Dysmenorrhea that worsens progressively and in fertility. Rationale: endometriosis causes ectopic endometrial tissue growth, leading to chronic pelvic pain, dysmenorrhea, and infertility. Pain is often progressive and cyclic. Question 3. A 45-year-old woman reports postmenopausal bleeding. What is the priority nursing action? A. Obtain a detailed menstrual history. B. Prepare for endometrial biopsy. C. Administer progesterone. D. Reassure her it's a normal finding. Answer B. Prepare for endometrial biopsy. Rationale: postmenopausal bleeding is abnormal and raises concern for endometrial carcinoma. Biopsy is essential to confirm or rule out malignancy. Question 4. A nurse reviews a patient's pap smear report that indicates ASCUS. What is the next step in management? A. Repeat pap in 3 years. B. Colposcopy. C. HPV testing. D. Immediate LEEP procedure. Answer C. HPV testing. Rationale: ASCUS, atypical squamous cells of undetermined significance, is followed by HPV testing to determine if high-risk HPV is present. If positive, colposcopy follows. Question 5. A woman undergoing hysterectomy suddenly experiences hypotension, bradycardia, and pallor after vaginal packing. What complication should the nurse suspect? A. Bladder injury. B. Vaginal cuff hematoma. C. Vagal stimulation. D. Pulmonary embolism. Answer C. Vagal stimulation. Rationale: Vagal response due to pelvic manipulation can trigger sudden bradycardia and hypotension. Supportive care and atropine may be required. Question 6. Which symptom best differentiates fibrocystic breast disease from breast carcinoma? A. Non-tender nodules. B. Fixed hard masses. C. Painful movable lumps before menstruation. D. Skin dimpling. Answer C. Painful movable lumps before menstruation. Rationale: fibrocystic changes are benign and fluctuate with the menstrual cycle, while cancer presents as hard, immobile, painless masses. Question 7. A nurse instructs a patient on tamoxifen therapy for breast cancer prevention. Which adverse effect should be reported immediately? A. Hot flashes. B. Vaginal dryness. C. Calf pain and swelling. D. Weight gain. Answer C. Calf pain and swelling. Rationale: tamoxifen increases the risk of thromboembolism. Calf pain and swelling suggest DVT and require urgent evaluation. Question 8. A 29-year-old patient with PID develops severe right upper quadrant pain and shoulder pain. What complication should the nurse suspect? A. Appendicitis. B. Fitzhugh-Curtis syndrome. C. Ovarian torsion. D. Perihepatitis. Answer B. Fitzhugh-Curtis syndrome. Rationale: this is perihepatic inflammation associated with PID caused by chlamydia or gonorrhea, presenting as RUQ pain due to liver capsule involvement. Question 9. During a pelvic exam, the nurse notes a bluish discoloration of the cervix. This sign is known as A. Chadwick sign. B. Goodell sign. C. Hegar sign. D. McDonald sign. Answer A. Chadwick sign. Rationale: Chadwick sign is a bluish-purple discoloration of the cervix from increased vascularity in early pregnancy. Question 10. A patient undergoing LEEP for cervical dysplasia should be instructed to A. Avoid sexual intercourse for 1 week. B. Expect foul-smelling discharge. C. Avoid tampons and douching for 3 weeks. D. Return to work the next day. Answer C. Avoid tampons and douching for 3 weeks. Rationale: these can irritate healing tissue and increase infection risk after cervical excision. Question 11. A 38-year-old with heavy menstrual bleeding is found to have a 7-centimeter intramural fibroid. She desires future fertility. Which treatment is most appropriate to preserve fertility while reducing symptoms? A. Hysterectomy. B. Myomectomy, fertility sparing. C. Uterine artery embolization, UAE. D. High-dose progestin therapy. Answer B. Myomectomy, fertility sparing. Rationale: myomectomy removes fibroids while preserving the uterus and fertility. Hysterectomy eliminates fertility. UAE may impair uterine blood flow and affect future pregnancy. High-dose progestins may reduce bleeding but are less effective for large symptomatic fibroids. Question 12. A client with advanced ovarian cancer is receiving cisplatin. Which lab abnormality is the nurse most concerned about as a dose-limiting toxicity of cisplatin? A. Hyperkalemia. B. Nephrotoxicity, elevated creatinine. C. Thrombocytosis. D. Hyperglycemia. Answer B. Nephrotoxicity, elevated creatinine. Rationale. Cisplatin is highly nephrotoxic. Monitoring BUN and creatinine is essential. Electrolyte disturbances can occur, but renal dysfunction is the main dose-limiting toxicity. Question 13. A patient with suspected adnexal torsion presents with sudden, severe unilateral pelvic pain and nausea. Which diagnostic step is most appropriate to confirm torsion emergently? A. Transvaginal ultrasound with Doppler flow. B. Abdominal X-ray. C. CT scan of the abdomen pelvis with contrast. D. MRI pelvis elective. Answer A. Transvaginal ultrasound with Doppler flow. Rationale. Transvaginal ultrasound assesses ovarian blood flow and is the first-line rapid test. Imaging should not delay surgical evaluation when torsion is highly suspected. Question 14. A 27-year-old with primary amenorrhea has normal breasts but absent uterus on pelvic ultrasound. Karyotype shows 46XY. What is the most likely diagnosis? A. Androgen insensitivity syndrome, AIS. B. Mullerian agenesis, Mayer-Rokitansky-Kusterhauser. C. Turner syndrome. D. Constitutional delayed puberty. Answer A. Androgen insensitivity syndrome, AIS. Rationale. Complete AIS 46XY presents with female external phenotype, normal breast development from peripheral aromatization of androgens, absent uterus due to Mullerian inhibiting factor from testes. MRKH is 46XX. Turner's is 45XO. Delayed puberty would not show absent uterus with 46XY. Question 15. Which feature best characterizes stress urinary incontinence, SUI, rather than urge incontinence? A. Sudden strong urge to void with small volumes of urine loss. B. Leaking with coughing, sneezing, or exertion. C. Nocturia and frequency. D. Detrusor overactivity on urodynamic testing. Answer B. Leaking with coughing, sneezing, or exertion. Rationale. SUI results from pelvic floor or urethral sphincter weakness. Leakage occurs with increased intra-abdominal pressure. Urge incontinence features sudden urgency and detrusor overactivity. Question 16. A 52-year-old on combined HRT, estrogen plus progestin, asks about endometrial cancer risk. Which statement is correct? A. Combined HRT increases endometrial cancer risk more than estrogen alone. B. Estrogen alone increases endometrial cancer risk. Adding progestin reduces that risk. C. HRT has no effect on endometrium. D. Progestin alone increases endometrial cancer risk. Answer B. Estrogen alone increases endometrial cancer risk. Adding progestin reduces that risk. Rationale. Unopposed estrogen stimulates the endometrium and increases cancer risk. Adding cyclic or continuous progestin opposes estrogen and lowers that risk. Question 17. A patient with gestational trophoblastic disease, complete molar pregnancy, has markedly elevated beta-HCG. Which complication requires immediate monitoring and treatment? A. Hyperemesis gravidera only. B. Choriocarcinoma only after 5 years. C. thyroid toxicity due to high HCG stimulating TSH receptors. D. Postpartum depression. Answer C. Thyroid toxicity due to high HCG stimulating TSH receptors. Rationale. Very high BHCG can cross-react with TSH receptors, causing thyroid toxicity, potentially life-threatening and requiring monitoring and therapy. Choriocarcinoma risk exists, but is managed with surveillance and chemo if needed. Question 18. Which ovarian tumor most commonly produces virilization in a premenopausal woman? A. Serous cystadenoma. B. Granulosus cell tumor. C. Sertoli-Leydig tumor. D. Mucinous cystadenoma. Answer C. Sertoli-Leydig tumor. Rationale. Sertoli-Leydig tumors produce androgens causing virilization. Granulosus cell tumors produce estrogen. Serous and mucinous cystadenomas are often non-hormone producing. Question 19. A patient with stage 2 endometrial cancer undergoes total abdominal hysterectomy with bilateral salpingo-oophorectomy, TAH-BSO. Which adjunctive therapy reduces recurrence risks in high-grade tumors? A. Pelvic radiotherapy. B. Oral contraceptives. C. Tamoxifen. D. No further therapy. Answer A. Pelvic radiotherapy. Rationale. Pelvic radiotherapy reduces local recurrence in higher stage or high-grade endometrial cancer. Systemic therapy may be added depending on risk features. Question 20. A nurse counsels a woman starting combined oral contraceptives. Which concurrent condition is an absolute contraindication? A. Age 35 and smoker of at least 15 cigarettes per day. B. Migraine without aura. C. Controlled hypertension on a single agent. D. Breastfeeding at 6 months postpartum. Answer A. Age 35 and smoker of at least 15 cigarettes per day. Rationale. Cigarette smoking at least 15 per day in women 35 and older on combined oral contraceptives significantly increases risk of serious cardiovascular events, an absolute contraindication. Migraine with aura is also a contraindication, and without aura is not absolute. Breastfeeding and combined OCP in early postpartum is generally discouraged.
Question 21. A woman with recurrent vulvar pruritus and white plaques on vulvar exam has a biopsy showing hyperkeratosis and thinning of vulvar epithelium. Diagnosis most consistent with A. Lichen sclerosis. B. Candida vaginitis. C. Lichen simplex chronicus. D. Psoriasis. Answer. Lichen sclerosis. Rationale. Lichen sclerosis causes thin, white, parchment-like vulvar epithelium and intense pruritus. Histology shows thinning of epidermis with hyperkeratosis and sclerosis. Question 22. Which finding on cervical cytology indicates high-grade squamous intraepithelial lesion, HSIL? A. Coilocytotic changes only. B. Marked nuclear enlargement and high NC ratio with loss of polarity. C. Rare atypical cells of undetermined significance. D. Benign endocervical cells. Answer. B. Marked nuclear enlargement and high NC ratio with loss of polarity. Rationale. HSIL shows significant dysplastic changes, marked nuclear atypia, high nuclear to cytoplasmic ratio, and architectural disarray. Coilocytes suggest HPV effect, LSAL/ASCUS. Question 23. A patient is scheduled for an anterior colporrhaphy for cystocele repair. Which postoperative complication should the nurse monitor for specifically? A. New onset urgency and incomplete bladder emptying. B. Diminished peripheral pulses. C. Increased deep tendon reflexes. D. Visual disturbance. Answer: A. New onset urgency and incomplete bladder emptying. Rationale: anterior repair may alter urethral/bladder dynamics, causing urinary retention or urgency. Monitoring voiding function is important. Question 24. Which tumor marker is most useful for monitoring epithelial ovarian cancer response to therapy? A. CYP125. B. AFP. C. beta-HCG. D. Inhibin B. Answer: CA125. Rationale: CA125 is commonly elevated in epithelial ovarian carcinoma and used to monitor treatment response and recurrence. AFP and beta-HCG are germ cell markers, Inhibin B for granulosa cell tumors. Question 25. A 30-year-old with suspected ectopic pregnancy has beta-HCG of 900 IU/L and transvaginal ultrasound shows no intrauterine pregnancy but small adnexal mass. Stable vitals. What is the most appropriate management? A. Immediate exploratory laparotomy. B. Methotrexate therapy, medical management, if criteria met. C. Expectant management only regardless of findings. D. Administer large dose of oxytocin. Answer: B. Methotrexate therapy, medical management, if criteria met. Rationale: in stable patients with small, unruptured ectopic and appropriate beta-HCG levels and no contraindications, methotrexate is an appropriate fertility-sparing treatment. Surgery if unstable or rupture. Question 26. Which genetic mutation is most commonly associated with hereditary breast and ovarian cancer syndrome? A. BRCA1/BRCA2. B. TP53 only. C. CRAS. D. APC. Answer: BRCA1/BRCA2. Rationale: BRCA1/2 mutations significantly increase risk for breast and ovarian cancers. Management includes enhanced surveillance and risk-reducing options. Question 27. A postpartum patient on postpartum day 3 develops fever, uterine tenderness, and purulent lochia. Best initial nursing action is: A. Start broad-spectrum 4 antibiotics and notify the provider for suspected endometritis. B. Reassure as normal postpartum temperature variation. C. Encourage ambulation only. D. Administer acetaminophen and observe. Answer: Start broad-spectrum 4 antibiotics and notify the provider for suspected endometritis. Rationale: postpartum endometritis presents with fever, uterine tenderness, and foul lochia, requires prompt antibiotics. Observation alone risks sepsis. Question 28. A 42-year-old with suspicious adnexal mass and ascites, what symptom constellation most raises concern for malignant ovarian neoplasm? A. Acute sharp localized pain only. B. Progressive abdominal distension, early satiety, unexplained weight loss. C. Colicky intermittent flank pain. D. Chronic constipation only. Answer: B. Progressive abdominal distension, early satiety, unexplained weight loss. Rationale: ovarian cancer often causes nonspecific GI symptoms, bloating, early satiety, ascites, and weight changes, often late presentation. Question 29. Which contraceptive offers the best non-hormonal, immediate protection and is safe in breastfeeding? A. Copper IUD, COUD. B. Combined oral contraceptive pill. C. Depot-medroxyprogesterone acetate, DMPA, injection. D. Vaginal ring. Answer: Copper IUD, COUD. Rationale: copper IUD is non-hormonal, provides immediate long-acting contraception, and is safe during breastfeeding. Hormonal methods may affect lactation early postpartum. Question 30. During radical hysterectomy for cervical cancer, the surgeon ligates the uterine arteries. Which nearby structure is at greatest risk of iatrogenic injury? A. Ureter, ureteric injury. B. Femoral nerve. C. Inferior vena cava. D. Sciatic nerve. Answer: ureter, ureteric injury. Rationale: the ureter runs under the uterine artery, water under the bridge, and is at risk during ligation. Identification and protection are essential. Question 31. A patient with amenorrhea and galactorrhea has elevated prolactin. MRI shows small pituitary microadenoma. Which medication is first line to reduce prolactin and shrink tumor? A. Bromocriptine or cabergoline, dopamine agonist. B. Prolactin injections. C. Estrogen therapy. D. Surgical resection immediately. Answer: bromocriptine or cabergoline, dopamine agonist. Rationale: dopamine agonists lower prolactin levels and often shrink prolactinomas, surgery reserved for resistant or large tumors causing mass effect. Question 32. Which finding on histology indicates invasive cervical carcinoma rather than carcinoma in situ? A. Full-thickness epithelial atypia without stromal invasion. B. Atypical cells confined to basal layer. C. Malignant epithelial cells breaching the basement membrane into stroma. D. Cholocytosis only. Answer: C. Malignant epithelial cells breaching the basement membrane into stroma. Rationale: invasion beyond the basement membrane into underlying stroma distinguishes invasive carcinoma from CIN/CIS. Question 33. A patient with heavy menses is started on 11-orgestrel IUD, LNGUD. Which change is most likely after insertion? A. Marked reduction in menstrual blood loss. Amenorrhea may develop over time. B. Immediate increased fertility. C. Increased systemic estrogen levels. D. Increased risk of ovarian cancer. Answer: marked reduction in menstrual blood loss. Amenorrhea may develop over time. Rationale: LNGUD releases progestin locally, thinning endometrium and reducing menstrual bleeding. Systemic effects are minimal. Question 34. Which form of vulvar cancer is most commonly associated with HPV infection? A. Basiloid and warty squamous cell carcinoma. B. Keratinizing squamous cell carcinoma, non-HPV. C. Melanoma of vulva. D. Bartholin gland adenocarcinoma. Answer: basiloid and warty squamous cell carcinoma. Rationale: HPV, especially high-risk types, is associated with basiloid/warty vulvar squamous cancers. Keratinizing types are more linked to lichen sclerosis and are HPV negative. Question 35. A 24-year-old with chlamydial salpingitis is treated with azithromycin. What is the most important counseling point to prevent reinfection? A. Abstain from alcohol for 2 weeks. B. Treat sexual partners and abstain until partners treated. C. Start combined OCPs immediately. D. Avoid dairy products. Answer: B. Treat sexual partners and abstain until partners treated. Rationale: partner treatment prevents reinfection. Abstinence until both treated reduces risk of recurrence and PID complications. Question 36. Which maternal condition increases the risk of placenta accreta spectrum, placenta accreta/increta/procreta? A. Prior cesarean section and placenta previa. B. Multiparity only. C. Maternal age less than 20. D. Low BMI. Answer: A. Prior cesarean section and placenta previa. Rationale: Previous uterine surgery and placenta previa are major risk factors for abnormal placental adherence, accreta spectrum, increasing hemorrhage risk. Question 37. In a patient with abnormal uterine bleeding and suspected von Willebrand disease, which screening test is most helpful initially? A. Prothrombin time, PT, only. B. Von Willebrand factor antigen and activity, Ristocetin cofactor. C. Serum fibrinogen only. D. Platelet count only. Answer: B. Von Willebrand factor antigen and activity, Ristocetin cofactor. Rationale: von Willebrand testing, antigen level and activity, detects VWD, PT and platelet count may be normal. Question 38. Which statement about endometrial hyperplasia with atypia is accurate regarding management? A. Hysterectomy is recommended for those who do not desire future fertility. B. Observation only is acceptable for all patients. C. Progestin therapy is contraindicated. D. It never progresses to carcinoma. Answer: A. Hysterectomy is recommended for those who do not desire future fertility. Rationale: atypical hyperplasia carries high risk of concurrent or subsequent carcinoma. Hysterectomy is definitive treatment for those not desiring fertility. Progestins can be used in fertility-preserving cases. Question 39. Which neonatal outcome is most associated with untreated maternal syphilis during pregnancy? A. Neonatal jaundice only. B. Stillbirth, hydrops fetalis, or congenital infection manifestations. C. Maternal hypertension only. D. Maternal hyperglycemia. Answer: B. Stillbirth, hydrops fetalis, or congenital infection manifestations. Rationale: untreated syphilis can cause fetal demise, congenital syphilis with multisystem disease, and significant neonatal morbidity. Question 40. A woman with endometriosis asks about infertility mechanisms. Which pathophysiologic explanation is most accurate? A. Endometrial implants can cause pelvic adhesions and distorted tubal anatomy, impairing ovum transport and implantation. B. Endometriosis increases ovarian reserve. C. Endometriosis sterilizes the uterus. D. Endometriosis results from primary ovarian failure. Answer: A. Endometrial implants can cause pelvic adhesions and distorted tubal anatomy, impairing ovum transport and implantation. Rationale: adhesions and inflammatory milieu from endometriosis impair fertility. Ovarian reserve is often reduced with disease progression or surgery, not increased. Question 41. During an infertility workup, a hysterosalpingogram, HSG, shows unilateral tubal blockage. Which is the most appropriate next step when considering fertility options? A. Counsel that unilateral blockage may still allow natural conception and consider expectant management versus assisted reproduction depending on duration of infertility. B. Immediate bilateral salpingectomy. C. Start empirical progesterone therapy only. D. Prescribe antibiotics only. Answer: A. Counsel that unilateral blockage may still allow natural conception and consider expectant management versus assisted reproduction depending on duration of infertility. Rationale: unilateral tubal patency often allows conception, management depends on age, infertility duration, partner factors. Surgical repair or IVF may be considered if fertility not achieved. Question 42. Which finding is most suggestive of pelvic inflammatory disease, PID, on pelvic exam? A. Cervical motion tenderness, positive chandelier sign. B. Painless vaginal bleeding only. C. Clear watery discharge only. D. Firm, non-tender uterus. Answer: cervical motion tenderness, positive chandelier sign. Rationale: cervical motion tenderness is a classic PID sign, combined with fever and discharge supports empiric treatment. Question 43. A woman with recurrent miscarriages is tested and found to have antiphospholipid antibody syndrome, APS. Which therapy reduces risk of pregnancy loss? A. Low-dose aspirin plus heparin during pregnancy. B. High-dose corticosteroids only. C. Avoid pregnancy only. D. Methotrexate during pregnancy. Answer: A. Low-dose aspirin plus heparin during pregnancy. Rationale: in APS, prophylactic low-dose aspirin with heparin throughout pregnancy reduces miscarriage risk and improves outcomes. Immunosuppression is not standard, methotrexate is teratogenic. Question 44. A 46-year-old with palpable adnexal mass and ascites undergoes paracentesis revealing malignant cells. Which staging procedure is most decisive for planning therapy? A. Surgical staging with cytoreductive surgery, debulking, and pathology. B. Repeat paracentesis only. C. Start oral antibiotics. D. Radiation therapy as first step. Answer: surgical staging with cytoreductive surgery, debulking, and pathology. Rationale: ovarian cancer management relies on surgical staging and optimal cytoreduction, pathology guides adjuvant chemo. Paracentesis is palliative. Question 45. Which pelvic mass features on ultrasound most strongly suggest a malignant adnexal tumor? A. Solid components with papillary projections, septations, and increased vascular flow. B. Simple unilocular cyst less than 3 cm with no septations. C. Anechoic thin-walled cyst consistent with corpus luteum. D. Hydrosalpinx appearance only. Answer: solid components with papillary projections, septations, and increased vascular flow. Rationale: complex morphology and increased blood flow raise suspicion for malignancy. Simple cysts are usually benign. Question 46. A client with premenstrual dysphoric disorder, PMDD, has severe mood symptoms in luteal phase only. Which treatment has strongest evidence for efficacy? A. SSRIs, especially when given during luteal phase or continuously. B. High-dose estrogen only. C. Long-acting antipsychotics only. D. Vitamin C supplementation only. Answer: A. SSRIs, especially when given during luteal phase or continuously. Rationale: SSRIs are first line for PMDD and can be used cyclically in luteal phase or continuously. Other options include ovulation suppression. Question 47. A patient with suspected tubo-ovarian abscess, TOA, is hemodynamically stable. Best initial management strategy. A. Broad-spectrum 4 antibiotics with close monitoring, consider drainage if no improvement or large abscess. B. Immediate hysterectomy. C. Oral azithromycin only. D. Wait without treatment. Answer: broad-spectrum 4 antibiotics with close monitoring, consider drainage if no improvement or large abscess. Rationale: TOA often responds to 4 antibiotics, drainage, image-guided or surgical, if large, ruptured, or refractory. Question 48. During preoperative counseling for oophorectomy in a premenopausal woman, nurse should teach that removal of both ovaries will cause
A. Immediate surgical menopause with vasomotor symptoms and increased long-term osteoporosis and cardiovascular risks if not managed. B. No change in hormonal status. C. Improved fertility. D. Increased estrogen production from uterus. Answer: A. Immediate surgical menopause with vasomotor symptoms and increased long-term osteoporosis and cardiovascular risks if not managed. Rationale: bilateral oophorectomy eliminates ovarian hormone production causing abrupt menopause. Discuss HRT and long-term risks/benefits. Question 49. Which contraceptive method has the highest typical use failure rate? A. Oral contraceptive pills. B. Male condoms. C. Copper IUD. D. Tubal ligation. Answer, B. Male condoms. Rationale, typical use failure is highest with condoms among these options due to user variability. IUDs and sterilization have very low failure rates. OCPs have moderate typical failure. Question 50. A 33-year-old with persistent abnormal uterine bleeding is found to have complex atypical hyperplasia on endometrial biopsy but wants future fertility. Which management is acceptable with close surveillance? A. High-dose progestin therapy, medroxyprogesterone or LNG-IUD, with frequent endometrial sampling. B. Immediate TAHBSO only. C. Radiation therapy only. D. No treatment and no follow-up. Answer, A. High-dose progestin therapy, medroxyprogesterone or LNG-IUD, with frequent endometrial sampling. Rationale, for patients desiring fertility, conservative management with progestin therapy and close surveillance can be attempted, definitive hysterectomy recommended if failed or no longer desiring fertility.
You made it to the end, and that already puts you ahead of most Nclex takers. Now it's your turn. How many questions did you get correct out of 50? Drop your score in the comments. I read every single one and love seeing your progress. If you learned something new today, don't forget to like, subscribe, and turn on the notification bell because more powerful Nclex question videos are coming right here on Nclex Made Easy 91.